So starting a family looks different for everyone, and sometimes that journey comes with more questions than it does answers.
That's right, and we're talking about families with human babies, not puppy babies. So understanding the basics of fertility for both women and men can help you feel more prepared to have those important conversations. And so joining us now is Dr. Alan Penzias. He is a reproductive endocrinologist and medical director at Boston IVF. Doctor, thanks for being with us.
Well, thank you for having me.
This is a really big topic, and it's something that people are learning about and often learn about when they need to, right? So what are some of the things that people, times in their lives where they should really consider going to a doctor and asking these questions?
Yeah, I think that's a great question because, human fertility and the desire to have children is pretty universal. If you think about all human cultures, one thing that unites us all is the desire to have children. And when that doesn't work, people can get very fearful. So I think that some of the keys are, if somebody has a desire to get pregnant, but they have a medical problem that they know right away. For a woman, for example, if her periods are not regular, that's a real sign that she should probably talk to a doctor or health provider right away. Or if she's had some other condition diagnosed, like endometriosis, or if she's had some pelvic infection or abdominal surgery, those things can interfere with fertility right away and probably knowing early on. And for men, if they have anything problematic with their reproductive system, they should get checked out.
And we're going to talk a little bit more about the men aspect in just a second. But for those who aren't familiar with the process, how would you describe fertility testing for people? And what are the 101s need to know before you go?
Yeah, fertility testing is really very basic. What we're looking at is to look at some structural things. So we want to know, is the shape of the uterus and the inside of the uterine cavity normal in size and shape? Are the fallopian tubes open? We'd like to know about the sperm element there, so a male semen analysis, how many sperm are there, what are their motions, and then for some hormonal panels that we look at, thyroid function, some endocrine things. It really only takes a month to do an entire fertility evaluation from tip to tail.
So curious about this, we talk about a woman maybe not having her period and talking to a provider. Is this something that people should wait until they want to start a family? Or if this is something that's happening in their young 20s and they don't want to have kids until their 30s, can they go to a fertility specialist at that point?
Oh, knowledge is power. I think that if somebody realizes that something isn't right and isn't like what their friends are and just doesn't feel correct, they should always talk to a doctor because an investigation doesn't mean you're getting treated, but it can set up for it later on.
And men are just as part of the conversation, like you mentioned up the top. What are some common misconceptions when it comes to male infertility as well?
I think that the biggest misconception about male fertility is that if a man has a normal ejaculate volume, that he's perfectly fine. Because even men who've had a vasectomy still have a normal ejaculate volume, but just they don't have sperm cells within that.
And so this is something that the male partner and the female partner can do together or individually, right?
Absolutely.
In the process. And I also heard something, I'm wondering if this is true, that male infertility is more common than female infertility?
Well, it's interesting because, for many, many years, there was a lot of shame associated with fertility, and women really felt the burden of all of this. But it's really mostly 50-50.
Oh. Wow. Well, thank you so much for the insight. I think overall it's empowering people to speak up, talk to their doctors about these conversations. Where can we find you?
You can find us on the web, bostonivf.com. We're located throughout the greater Boston area and throughout New England.
If you have more questions, you go to Dr. Penzias.
Yeah, you know where to go. All right. Well, thank you for joining us this morning. And thank you guys for hanging out with us. We will be back tomorrow with lots more of fun and good stuff. Yeah. So we'll see you back here tomorrow.
Bye.